Hello, YouTube family. It's Dr. Bove, aka Captain Crunch. Thank you for tuning in. Tonight we're adjusting Hannah. Hannah has been a patient, oh my gosh, I don't even know, when like middle school, even before that. She just recently, she plays sports. She's, a complete athlete, but she had a pretty significant concussion injury. Thank God she's all recovered from that. She did a lot at home and, a lot of PT and work on that. But I was also pleased and blessed that she came in and got adjusted. So, how are you feeling today?
I'm feeling pretty good. I just have some neck pain.
Okay.
And my head's been bothering me.
All right. In the past, Hannah also has had some headache issues, chronic here and there. But thankfully, she's awesome, comes in and has been doing great. Okay, cool. Let's check it out. All right, lay facing down, please. Nothing happened, right?
No.
No trauma or anything. What are you playing now?
Lacrosse.
Oh, cool. Women's lacrosse, man, you guys are animals, man. You don't wear any pads at all. Just like these little eyeglass things with bars. It is one of my favorites though. I played lacrosse for years. I still, here and there when I can play in a men's league. It is so fun. Yeah, I definitely feel that too. Okay, we'll fix that up. Can you feel the difference there? This is so tight.
Yeah, it's a little tight there.
Oh, this would be a great example for you guys watching. This, people a lot of times always ask, well, how do you know? What does it feel like? Well, think of if you make a muscle. It's hard. It's not pliable like normal muscle tissue is, and that's what's happening here on Hannah's left side of her low back. And there's got to be a reason for that. That doesn't just happen unless there's rotation, change in alignment, change in the biomechanics. So we got to discover where that is and then correct it, fix it, and then the body will stop doing that. Now you can also have sprain strain, but we didn't have any incidents, we didn't have any injuries, and sprain strain you would know, you would feel it. So this is just straight up misalignment right here. We call it subluxation as chiropractors. It's a misalignment that's enough to put pressure on nerves. It's less than a dislocation, but it's enough to irritate the nerves that are exiting from those segments. Perfect, yeah, right there. We'll fix that right up. Cool, all right, deep breath. Let it all the way out. Great. Okay, we'll hug for that one. Turn on your side facing me. Oh boy. Thank you. Finally, it moved. All right. All right, go on your back. Beautiful. Okay, rest your legs. Perfect. That was awesome. Hips totally moved. Okay, crisscross. We got a hug. That was better. All right. You have your hands. How's your head been?
Good.
No headaches?
No.
Good. Thank God. How was school today?
Good.
Yeah. It's almost over, man. Can you believe it? You're going to be sad when it's over?
No.
Okay. tight muscle right there. Okay, we're gonna hold this. Soften it up. Beautiful. Oh, made my day. All right, turn and face me this way on your side. Perfect. That was better. All right, come on up. Have a seat. Keep your legs down. Back. Hey, your low back on that left side gave me a workout, man. That was tough. So we'll double check it all. Yeah, almost. Let me have that left hand. We're going to twist, twist, twist. Just holding this point. Softening the muscle. Good. Perfect. All right, switch hands. Beautiful. Perfect. You feel great, Hannah. All right. At least the alignment to me feels great. A little tight down here. Some heat would be nice tonight. You know, hot shower, hot bath. All right. Gentle stretching, knee to chest. You know, that kind of stuff. Cool.
Thank you.
Please, thank you so much for being our model tonight. Thank you for tuning in. Thank you for subscribing and liking. And we'll keep making, fun educational adjustment videos. Thanks. See ya.